Good morning, Dr. Deuk here from Deuk Spine Institute, and I have a lovely patient of mine who is visiting from where?
From Bath in the UK.
From the UK. And what are you doing at Deuk Spine Institute?
I'm hoping that you're going to fix my neck for me.
All right, so we're going to fix her neck, and we're going to be doing that tomorrow, right?
Yeah.
And what are we doing tomorrow for you?
It's C6-C7 and rhizotomy.
C5-C6-C7 laser, Deuk laser disc repair, and the rhizotomy. Yeah. Good. Well, why would we do the surgery for you? What kind of problems are you having?
I keep getting cramp and numbness in my left arm, and the muscles have started to waste, and I get neck pain.
Okay, so neck pain and then going down your left arm with cramping in the arm and atrophy of the muscles. That's a good reason. So she has a radiculopathy and she has axial pain. What are your expectations for the surgery? What are you hoping to achieve?
I would like my arm to be pain-free, and I really like my neck to be pain-free as well. But I'll settle for my arm working properly and the muscles to come back again.
Well, we're going to do both. What about headaches? Do you ever get headaches that come up here?
Yeah, they're nasty.
You do?
Yeah.
From your neck?
Yeah.
We call that a cervicogenic headache. The patients that I've done the laser surgery on have about 95% relief of that headache after the surgery.
That will be very nice.
Isn't that nice? All right. So how did you hear about Deuk Spine Institute? And why are you here? Where did you hear about us?
I'd looked at treatment in the UK and didn't find the options that were on offer particularly palatable because I would lose movement. And if they fixed one level, it would put strain on the ones above. Mm-hmm. So it would be a constant battle to fix the next. And one of my friends was working in the US and knew about what you do here.
All right, but what does your friend do? I mean, isn't it through motorsports? Tell us about that.
Yeah, it's he mechanics in the US on the kart circuit. So he's no knowledge of clinical issues whatsoever. So his recommendation and the information he passed to me didn't have any baggage with it. And I've done my homework, and I think this is the best option for me.
All right, good. So you learned about Deuk Spine through the racing, through Arias basically, right?
Yes.
And you did your research, and you don't want a metal plate in your neck, as you pointed out, because that's going to stiffen your neck and cause all kinds of problems. You want the laser surgery.
Yeah, I'm active. I don't want to lose the movement in my neck. Plus, if they put the plate in, because of the way they go in, there is a likelihood of damaging the voice box, swallowing, and that wasn't palatable.
Yeah, that's true, but not with the laser surgery. We've had 0 complications in 900 plus cases. So, all right, anything else you want to say to the viewers?
No, keep your fingers crossed, and I'll let you know how it goes.
All right, well, tune in tomorrow for live surgery, and we'll be performing a Deuk laser disc repair, C5-C6-C7. All right.
Thank you.
You're welcome. All right.